Good morning. Today we will be discussing Haemophilus, an important bacterium in respiratory and invasive infections. Let's start with a clinical case to set the scene. We have Mr. HM, a 75-year-old patient with a history of chronic bronchitis. He presents with a cough and purulent sputum, and he is febrile. These symptoms have been evolving for about 48 hours. On examination, his temperature is 39 degrees, and upon auscultation, we hear crackles at the base of his left lung. So, I'll pose the question to you. What sample would you take in this situation? Here are the laboratory findings from this case. A direct examination of the sputum sample was performed, and it revealed gram-negative polymorphic bacilli. Subsequently, the culture came back positive for Haemophilus influenzae. Now, let's move on to some general information about the genus Haemophilus. They are gram-negative polymorphic bacilli. They are typically commensals of the upper respiratory tract, meaning they can live there harmlessly in many people. The most clinically significant species is Haemophilus influenzae, also known as Pfeiffer's bacillus, which is responsible for a range of invasive infections. This leads us to an important point: the major impact of vaccination in preventing the most severe forms of the disease. Now, let's take a moment to discuss the epidemiology and transmission of Haemophilus influenzae. As mentioned earlier, this bacterium is a common commensal of the upper airways, meaning it can reside naturally in the nose and throat without causing harm. This is true for both children and adults. The colonization rate is quite high. In fact, it's estimated that 40 to 60% of children carry this bacterium in their upper respiratory tract and at any given time. Because it can live harmlessly in its host, but also has the potential to cause disease under certain conditions, we classify it as a specific facultative pathogen. Finally, how is it spread? Transmission is direct from human to human, primarily through respiratory droplets from coughing or sneezing. Let's look at the bacteriological characteristics. As we saw in the case, they are morphologically described as polymorphic gram-negative bacilli. A key feature of Haemophilus is its fastidious growth requirements. To grow in the lab, it needs two specific factors: factor E, which is hemin, and factor V, which is nicotinamide adenine dinucleotide or NAD. It's also a relatively fragile microorganism, sensitive to environmental conditions. Moving on to the antigenic structure. Some strains of Haemophilus influenzae possess a polysaccharide capsule. This capsule is inconstant, meaning not all strains have it. For those that do, there are six different antigenic varieties, labeled A through F. Among these, serotype B is the most important as it is responsible for the majority of invasive infections such as meningitis. The introduction of the Hib vaccine, the vaccine against Haemophilus influenzae type B, into routine vaccination schedules has led to a marked decrease in the incidence of Hib meningitis worldwide. What is the pathogenic potential of Haemophilus? Cause a variety of infections. First, it's a common cause of ENT infections such as acute otitis media and sinusitis. Second, as mentioned, Serotype B is responsible for serious invasive infections in children, including meningitis, epiglottitis, and septic arthritis. Third, it can act as a secondary invader, causing superinfections that complicate viral infections like influenza or measles. Finally, in adults, particularly those with underlying lung disease like our patient Mr. HM, it's a major cause of purulent exacerbations of acute and chronic bronchitis. How do you make a bacteriological diagnosis? The first step is taking a sample from the site of infection. This could be cerebrospinal fluid for suspected meningitis or sputum for respiratory infection, like in our case. The direct diagnosis then involves two main steps: microscopic examination of the sample, which may show the characteristic gram-negative polymorphic bacilli, and culture on enriched media, which must be supplemented with factors X and V to allow the bacteria to grow. Additionally, for suspected meningitis, we can perform a rapid test to detect type B capsular soluble antigens directly in the CSF. What about treatment? Haemophilus influenzae is generally susceptible to third-generation cephalosporins, which are often used for severe infections like meningitis. However, it's important to know that resistance to aminopenicillins like ampicillin is common. This is usually due to the production of the enzyme penicillinase. There is also a noted decreased susceptibility to macrolides. Finally, prevention. The hip vaccine is a crucial preventive measure and is part of the Tunisian vaccination schedule. It is administered to infants at 2, 3, and 6 months of age to protect them against invasive Haemophilus influenzae type B disease. This concludes our presentation on Haemophilus. Thank you.